It's a privilege to introduce our next segment entitled COVID-19, A Global Journey, presented by Dr. Mohamud Verjee. Dr. Verjee qualified from the University of Dundee, Scotland, UK, and worked as a family physician in Oxford until 1994, before moving to Alberta, Canada. He was appointed Clerkship Director for Family Medicine at the University of Calgary, Alberta, Canada, in 2003, before joining Weill Cornell Medicine, Qatar, in 2007 to set up the primary care clerkship. A practicing physician, faculty member, teacher, educator, researcher, writer, motivational speaker, and multiple award recipient, his academic fields of interest are widespread. They include disruptive innovation in learning, lifestyle medicine, student health and well-being, public health, exploring the metaphorical spaces of narrative medicine, and teaching empathy to students. An alum of the Harvard Macy Institute in Boston since 2009, he completed his MBA in Leadership and Sustainability in 2015. He was accorded Fellowship of the College of Family Physicians of Canada in 2014, and selected as a Senior Fellow in Mental Health Research in 2017 at Clare College, Cambridge University, England. Dr. Verjee has been at WCMQ since July 2007 and is the Assistant Dean for Medical Student Affairs, as well as a co-director of the Family Medicine Clerkship. At the end of the session, we will open the floor for questions. You may type in your questions during or after the presentation, and Dr. Verjee will be happy to respond to you as best as he can after his presentation. Over to you, Dr. Verjee.
Thank you, Abir, for your very warm welcome. Good afternoon to everybody. The title of my talk is A Global Journey. And when I chose that title, I actually looked at what was happening to us today. I have no conflicts of interest. This disclaimer does not intend to constitute any legal or professional advice. Well, in real life today, we carry a lot of bugs on our body. I've given this picture to you to see, and look at the dark blue, which are the good areas. This is on our skin, and this is a picture of the front of the foot. This is the bottom of your foot. Where it's dark blue, that's a good sign. Where there's red or a color, that's not a good sign. That shows where bugs are growing on a daily basis. Think of that when you next look at your foot. I want to ask you, I want to explain to you rather what an infection actually is. We have bugs in our body every day, all the time, all our life. I'm not sure if you're aware, but we have something like 6 pounds of bugs, bacteria in our body to keep us well. We need them. They manufacture certain goods and vitamins that we actually need to process and live on. When you have an infection, that means that it's an invasion of bacteria which are not normally found in the body or are harmful. That includes viruses and parasites. So an infection may be localized, or it may spread through the bloodstream into special channels. Some of these channels are called lymphatic vessels, and they, in fact, are a sign of an infection. But when it actually invades the body, that's much more serious, when there's a systemic infection. So examples of an infection are if you cut yourself and it becomes very sore and red and perhaps there's some discharge, or if you eat tainted food, such as in food poisoning, or if it invades your body, which is very serious, and that's a condition called septicemia or blood poisoning. And we know about pneumonia, we know about meningitis, and the simple strep sore throat. What does vaccination mean? A vaccine stimulates the body to protect itself by producing antibodies against a disease which we want to prevent. So tetanus is something that we all have. We get a tetanus injection. That actually is a vaccination, and we are protected by stimulating antibodies within our own body. What does immunization mean? Is the process of giving that vaccine, such as tetanus again, by injection or mouth, or polio. And I have a slide to show you about polio from historic times. So what started COVID-19? There are just so many theories. We're not sure exactly. One theory has been it started in wet markets. Other theory says it originated from bats. And if it was transmitted from animals to humans, how did that happen? We know that the bat virus, which is very similar to the COVID-19, is not exactly the same type. So there has to have been some environmental change. What is the best answer of how COVID-19 started? We really don't know at this time. We need to work on it with more research. This is a name you will recognize, Abu Ali ibn Sina, who lived a long time ago in 980 to 1037 AD. He was one of the first people to recognize and suspect that diseases were spread by very small particles. The terms bacteria and viruses were not known at that time. He came up with the mechanism of saying, if we have a 40-day period of isolation, then the disease will fade and go away. The al-arba'iniya, the 40, is a term that was coined at that time. And when traders who moved across the continent heard it, they took it back, particularly to Europe and Italy. And in Italy, they called it quarantina, and that's 40 in Italian, hence the origin of quarantine. He was the prince of physicians. He's known as Avicenna in the West and regarded as one of the most august and significant physicians, astronomers and thinker and creative writer of the Islamic Golden Age. He's the father of early modern medicine, the Al-Kanab fil Tib. And if any of you have ever been to Kuwait and gone to the Tariq Rajab Museum, the private museum, you will be privileged to see, under armor-plated glass I had, a copy, one of possibly only 6 known in existence, of Ibn Sina's La Canon, the first Principles of Medicine book. Now, I'm going to talk a bit about plague because this was a pandemic that was recognized in Asia over 2,000 years ago. Very likely with trading, it was spread by trading ships carrying pests such as rats. And the bacterial pathogen from the Black Death may have existed in Europe as early as 3000 BC. That's a long, long time ago. So what we're experiencing today is not effectively new in the world, but it's new to us. Here is the spread, a map of the spread of plague known as bubonic plague in the 14th century. You will see the colors, 1347, 1348, and so on, defining the years. And you'll see a passage. The arrows come down into what is now modern Turkey and Greece, across into Italy, into France, up into Britain, and then into the Scandinavian area, and then back into Russia. So this, in fact, is familiar to us because we've seen COVID-19 spread from country to country to country. This is what causes it all. It doesn't look very harmful. It looks a little bit pretty in one way, but this is certainly very, very important and something we really don't want to see in anybody when we grow any cultures. Imam Sir Sultan Muhammad Shah, His Highness the Aga Khan III, was in fact alive and 20 years old when the Great Plague broke out in 1897. And he, in fact, wrote at that time, there was a natural and general tendency to discredit its seriousness. We've seen how serious it was from the 14th century. What do we see today? As we have seen, history repeats itself. And from the book, The Memoirs of Aga Khan, again, another quote. We were all compelled to face the fact that it was indeed an epidemic of disastrous proportions. And for those who want to read more, please refer to the Memoirs of Aga Khan, published by Cassell from 1954. It's out of print now. If you can get a copy, you'll be lucky, on pages 36 to 39. This is what an influenza virus looks like, and it's very similar to the COVID-19 virus. They're part of the same family, but they are not absolutely the same. The Spanish flu is talked about a lot. And really, what was that? That was a flu virus that changed. Actually, it wasn't from Spain at all. It was over the whole of Europe in 1918, 1919. The fact that a lot of people allude to it as the Spanish flu was because there was a restriction on information sharing in Europe because of the World War. But in Spain, there was a neutral country. So when the King of Spain, King Carlos, fell ill, there were daily reports about the influenza pandemic. And so it appeared that all the activity was going on in Spain when it wasn't. And it circulated globally. And then it returned in 1957 as what is called the Asian flu. But after the First World War, it declined. At that time, they had rudimentary masks, which actually were ineffective. And we're not sure whether, in fact, they had the right stuff, but we've improved today. Antibiotics are definitely not indicated in any flu injection. And we have to have an annual flu vaccination for the flu itself, as advised every year, particularly in those people who are at risk with diabetes or hypertension or heart disease. So the flu vaccination protects you, and you cannot get flu from the vaccination, I can assure you, although many people think they can. If you get flu after being vaccinated, you have probably been infected before your vaccination, because it takes about 14 days to be immune to the infection. And it's not always correct. They sometimes have to change them every year. So here is, in fact, an Egyptian stele, a stone tablet carved, thought to represent a polio victim from the 18th dynasty, and that was in 1403, 1365 BC. If you look at the tablet very carefully, you'll see this man standing on a normal leg, and you'll see this leg, which is very withered and thin, and he's standing on the ball of his foot. And here is a crutch, which he's using for support. So these infections are well known in history. COVID-19. It happened before in 1918, not COVID-19, but this was the pandemic of flu. And there is, in fact, a very, very good article by Kathleen O'Mara. And it said, I'll read part of it, and people stayed at home and read books and listened, and they rested, and they did exercises, and they made art and played and learned new ways of being, and stopped and listened more deeply. Some meditated, some prayed, some met their shadow. And people began to think differently, and people healed. And in the absence of people who lived in ignorant ways, dangerous, meaningless, and heartless, the earth also began to heal. And when the danger ended and people found themselves, they grieved for the dead and made new choices and dreamed of new visions and created new ways of living and completely healed the earth just as they were healed. It's a lovely story, it's a lovely piece, and the picture of two women here wearing their rudimentary masks or dressed in hats. So who are the people at risk? The people at risk are those who have heart disease, diabetes, respiratory lung problems, increased blood pressure, cancer, and some with no condition at all. This COVID-19 can affect anybody of all age groups, and it can affect you from head to toe. It is devastating. Symptoms that you must always take seriously is a fever. If you develop a fever, then you must take note and seek medical attention. You should also look out for a persistent dry cough after 3 or 4 days after developing a fever. That is a very important sign, and you must definitely not ignore that. You must seek help. If you actually go on further to have difficulty in breathing about a week later after your fever starts, that actually is not a good sign. You may also have muscle pain and fatigue, and some people have lost their sense of taste and smell. but that actually is one of the minor signs. It shows you've probably been infected, but it's not going to get much more serious. So what can we do? Well, we can wash our hands as often as you remember, and do that for at least 20 seconds. That's the time it takes you to sing happy birthday to yourself twice. So whenever you touch something outside, or a bin, a door handle, a keyboard, which is not yours, and that includes shop purchases there, you should not touch anything and then forget to wash your hands. We've been very fortunate today in having a message from Maulana Hazrat Imam, who's emphasized what we should do and what we should adhere to and what we should follow. And some of his words include strict personal hygiene practices. One might say this is something we should do every day of our lives. But we need reminding now, and that advice is there. It's been stated. Also, the fact that we must stay at home, going back to the quarantine principle, a self-quarantine, a self-isolation. That means absolutely no social visiting to anyone, by anyone, going anywhere. This concept of physical distancing has been reiterated also by Maulana Hazrat Imam. So when you go out food shopping, you must remember to keep your distance from other people. If they push in front of you, just step back, let them go, and keep that distance. 2 meters is the advisable safety margin. Now, you're going to ask, what happens if you develop a fever? Well, you should ring the hotline in your own Gulf country's service and seek advice. Even if you're worried, ring them and seek advice. If you develop a fever and then a dry cough, you must call. You urge to call one of the 24-hour hotline numbers first in your state and then get instruction. What are the personal protective measures we must take? Well, I've already mentioned proper hand hygiene. That's with soap. Soap is the best, soap and water. The next best is a sanitizer, which is useful, of course, if you haven't got access to water and you're traveling in the car or visiting a place to buy food. You should, if you do have a cough or sneeze, this is part of personal hygiene. You should cough into your elbow or a tissue, and then when you've actually used the tissue, throw that, discard it safely into a bin, and then wash your hands. Again, the guidance has come that everyone needs to follow the government directions and regulations, and that includes wearing masks in many countries, if not all now. They should be worn by all healthcare workers. Certainly, they are a priority for those people who work on the front line, and for those who care for the ill at home and those who are sick. What are the environmental measures? Well, you need to make sure that every product, everything you buy, comes home and is wiped clean with disinfectant. Frequently clean all areas in your home with disinfectant as well. Be careful of your clothes. Keep them clean and wash them regularly. And if there's any suspicion of contamination, wash them immediately. And any common objects in use. So it's useful to make sure you clean your keyboard, for instance. Don't share any objects. Don't share any utensils. Someone in your family, unknown to you, may have picked this up, and that unwittingly could be passed just because you want a taste of something. Don't share any utensils. And it's good to have ventilation and fresh air at all times. So the advice I give is that you should stand at least 2 meters away from any visibly symptomatic person. Someone in front of you is coughing, you need to step away from them as fast as you can, really. Don't hesitate. And it's not being rude, it's just a question of protecting yourself. If you do have a cough, it may not be COVID-19, but it's important to self-isolate yourself so you're not a risk or a hazard to anybody else. And probably the social distancing factor, which Hazrat Imam again has reiterated as being very important, is probably the most important measure to reduce disease transmission and limit the spread of this virus within any community. I say again, no visiting and no visits to your home by others and no visiting to others. Even relatives should not come home to you if they do not live in the same home. So what must we consider? We must always follow the government's advice. We must be obedient and listen to the leadership of the country that we're in. The impact of social isolation is novel in that sense. We're not used to it. For yourselves, for your families, and especially for the elderly, being alone is not a pleasant thing. But we're all united at this time to look after each other, and we should be responsible for each other's actions. There is the mental and psychological stress of not being able to live a perfectly normal life, of not being able to interact with people, of not being able to go to work, of not being able to travel without some apprehension. What is also very good is that you must try and keep fit. You must exercise. We know that building your muscle improves your overall immunity. So don't be a couch potato. Aim for moderate activity, a minimum of 7,500 steps at home, in your villa, in your house, wherever you are, if you have a small back garden, is very, very important. Of course, you must eat healthily as well, and not to excess. We're now in the period of Ramadan, and it's important to keep hydrated when Ramadan hours are over. And before that, of course. You should also try and get good quality sleep. 7 to 9 hours is the advised time to stay asleep. But that means having no naps during the day, or otherwise you won't sleep very well at night. 7 hours minimum, 9 hours maximum. If you stay in bed for longer than 9 hours, say 10 or 12 hours, your muscles are already being affected, and you will actually feel slightly weaker than you would have if you had had only 9 hours sleep. Of course, financial security and asset protection is another worry, and businesses and livelihoods are being affected on a daily, if not hourly basis. What can we do about that? The spiritual connection that we have to anyone of any faith, as many times as you want to seek comfort, at any time at all in the day. And what else is the last thing I put down? When will this pandemic end? Honest and truthful answer is we do not know. We cannot even guess. We can hope for, but we do not know. And there's so many theories and so many solutions being provided, it's hard to know what's fact and what's fiction. What should we not do? We should not spread any rumors. If you hear something and it comes from social media and it seems exciting or it seems like news, be very careful, especially if it refers to cures or so-called remedies. Do not share unverified facts received on social media. And do not ignore advice on medicines which are possibly harmful. One of those is hydroxychloroquine, which has been mooted as being a potential cure. I'm afraid there is no evidence to show that it helps at all. And in fact, this medicine is used in certain people for a certain condition called lupus. But taken by people who don't need it, it can actually prove harmful. How? It affects your heart rhythm, and it can upset your natural heart rhythm and cause cardiac problems. That actually might prove to be fatal. So no one should be tempted to take things just because they hear it might be a good idea. What should we not do? We should not take any risks. We shouldn't wander around. We shouldn't go to places which are crowded. We should not go to parks or public places. We should not congregate in people with whom we do not know. Only the family lives in your house. If you do go out, a maximum of 2 people, and preferably with a mask. That is the best advice we can give you right now. So, future developments. There's a lot of talk about a vaccine for COVID-19. Is it going to work? I firmly believe that there will be a vaccine because this virus doesn't seem to have the ability to mutate and change, not like the flu virus. So I no doubt that we will get a vaccine in due course, but it has to go through certain safety protocols first. We don't want a rogue vaccine being administered in a hurry and then finding we're giving people new problems to deal with. I personally, professionally, do not think it'll happen before 2021. And if it does happen sooner, then that's a bonus for us. This disease, COVID-19, will decrease due to what's called herd immunity. Unfortunately, we don't want anyone to have this disease, but one of the ways we've learned from the past is that when a disease occurs, the more people who are infected and recover, the more they are protected for the future. We hear now of big figures around the world, something like in excess of 2.5 million today who have been infected. In actual fact, there's probably 10 to 12 million people who've probably been infected, but in fact don't know it because they've not had any symptoms. Because this is a totally new virus, the whole world has not had immunity to fight this successfully. But 80% of the people who actually do get this disease will recover to full normality. So once that immunity is within the community, in the herd, if you like, then we will be protected for the future. We need to be sure that our personal hygiene is taught to the upcoming generation to get them into the habit of looking after themselves and making sure that practices that we perhaps look on as being undesirable are no more, and that there is a regime and a habit to follow. I've mentioned that 80% who catch COVID-19 will recover fully. Most infected people don't even know they've got it. But what we actually are witnessing is a better environment, much less pollution. The pollution in various countries, well noted for having a poor record, are so transformed today. It's a lesson for us to be more careful for the future. And what about the educational shift? Working from home is a new experience. We all think we might like to work at home, but have you worked at home this long, online, ever before? And it's a complete change. I do hope that we actually will see the flattening of the curve in the Gulf region, hopefully sooner rather than later. But let's be conservative and say perhaps in about 3 months we'll see a trend and we'll know that we are winning. I'm going to go through some myths and facts here and explain some of them. We could spend a whole talk on just this alone, but I want to emphasize that Panadol and ibuprofen are equally safe. Some have said that ibuprofen is not so safe. That's not true. Panadol and ibuprofen are equally effective. There's been talk about warmth and sunlight and heat above 25 degrees centigrade being a cure. That is not true. COVID-19 exists in any climate. It just happens to be rampant right at the moment. But as you will know, the Gulf region is quite a warm area, and yet we still have it. There's a myth that there's a vaccine now available or about to be produced, sort of something in the next month or so, against COVID-19. That, I'm sorry to say, is a complete myth. It is not true, and I've already been through the vaccine component of my talk. Most people catching COVID-19 who recover eliminate the virus from their body completely. That is fact. Once you've had COVID-19 infection and you recover, you no longer have the virus in your body. We're not quite sure if people can still transmit the disease, but effectively you are cured. The virus has been completely eliminated, and we know that from current studies. Being able to hold your breath for 10 seconds means you're COVID-free. Not true. Drinking alcohol kills the virus. Not true. COVID-19 in hot climates, I've discussed that. Cold weather kills COVID-19. Another myth, I'm afraid. This virus can live in a normal refrigerator in temperatures well below normal, in freezing, and can actually live up to 28 days in your freezer. So once you have contaminated products or coverings, it's there and it's alive. And that's why you must always disinfect and clean all your food, packaging, your vegetables, fruit, etc. when you come home, first thing before you put it away. It's fairly easy, it may be laborious, but actually it's very good policy. Garlic helps to clear the virus. Not true. Garlic may have an effect on blood pressure and controlling that, taken regularly. It does nothing for the virus. And infected people without symptoms who don't appear to be ill can infect others. That, unfortunately, is true. You may not know who's standing next to you, and they could infect you unwittingly, even though they seem perfectly well. And that's why we have such a wide distribution of people falling sick throughout the global domain. I want to thank you for listening and joining us today. And I'm going to actually be free to answer questions that you may have. Abir.
Thank you so much, Dr. Verjee, for your valuable insight on COVID-19. The first question that's come in from our audience is, how long can the virus remain on surfaces such as door handles?
This is debatable, but there are thoughts that a virus can exist on the metal and plastic surfaces in normal environments for about 2 hours or up to 48 hours. It depends on the material and the environment, if it's moist or if it's dry. I would recommend that people don't worry too much about it. Something like about 4 to 6 hours would be about the maximum. This virus dies very easily without a host. If it doesn't infect anybody, it dies. It can't live on plastic.
Thank you. The next question is, during the month of Ramadan, how can we keep our immunity up given that we are going to fast?
The best thing, in fact, to keep our immunity going is to live healthily, keep ourselves clean, eat at the right time, drink fluids at the right time, exercise, ensure that we actually get enough sleep, and also try and have peace of mind. Those are the best ways to actually try and give your body the very best of chances.
Perfect.
Very, very important. In fact, that's fine.
If I have the choice to stay home or go out for essentials like groceries, what would you advise?
I would only go out for groceries if they are essential needs for the household. You should not just go down and have a general shop and say, I haven't seen this before. Let me have a look. No, you should have a list. You should go there, have a defined time, and get as much as you can in a list, and then leave, pay and leave as quickly as you can. I recommend once every 2 weeks is a reasonable frequency of visits. Hazrat Mohammed said, this is a very contagious virus. And we've seen the damage it can do to human life and societies there. Everyone must be personally responsible for exercising all possible steps to protect their good health, safety, and well-being, and that of their families there. It's important not to linger in a shop if you're going out. And the only real excuse for going out right now is to get supplies, get food, fresh vegetables, and fruit, and of course all the other produce.
Thank you. So if I'm running my own business and I have the choice to keep it closed and stay home, should I?
If you're running your business, there will be rules from each government as to what you can do if your business is outside the home. You are not going to have any customers. You are not allowed to have staff actually working there. There may be times when you actually are in an exceptional position of experience where you're needed on site, but that will be exceptional. But if you have your general home business, all the work should be, until further notice, carried out from home to the best of your ability.
Thank you. Our next question is, does the use of steam help to reduce the risk of COVID-19?
No, it does not. A simple answer.
Another question is, what type of skills should we develop for after the pandemic to cope with financial downfall?
I'm sorry, I missed the first word that you said. What sort of?
What type of skills should we look to develop?
I think the skills that we need will be the ones we develop right now. If we actually, once the pandemic is over, we will need to learn and reintegrate into normal society. I think the best skills to develop now are a sense of compassion, empathy, sincerity, truthfulness, hope, and spiritual uplifting. Those will transcend everything you do in the material part of life and business. We should certainly absolutely listen to all the government and health agencies, and we must comply with the rules. What we cannot do right now is take chances and pretend, if you like, that nothing much has happened and that things can go on as normal. They can't. We have had to change. We need to change, and we will have to adapt to our own personal best practices so that we move forward in the way that we want to for the success and benefit of families, communities, and the countries as a whole.
Someone is asking, should we remove the plastic cover of frozen chicken before putting it in the freezer?
No, you don't have to do that. In fact, you risk perhaps greater risk of contamination. What is important is that when you have your package of chicken and bring it home in a plastic bag, by the way, don't take any cloth bags of your own or these reusable bags at this time. Use the ones that are brand new, which are supplied to you. Take out the package of chicken and wipe it with a dilute solution of disinfectant. With a sponge or the cloth, just wipe the whole surface, front and back. You don't have to soak it, you don't have to dunk it in water, you don't have to do anything more than that. You need to protect yourself, of course, if you've touched anything which might be contaminated, and you just hold it, and as you wipe it, you're going to recontaminate it. So you must do what? Wash your hands for 20 seconds thoroughly before you touch anything. Then you can wear gloves, and then you can wipe everything down. Once it's wiped and dried, you can then put it safely in the freezer or the fridge. And that applies to all meat, all products, and all containers, all cardboard boxes, all bottles, all silver wrappers and what have you. That includes sweets as well.
Perfect, thank you. What developments have been made for the antibodies test since reinfections are on the rise?
Well, we're not sure that reinfections are on the rise. The thing at the moment is there has been some work going on in Oxford, and they've already started trials in trying to develop a vaccine by using people who have recovered and using their serum. And they hope to conduct this trial. Half of the people have got serum taken from them, and half of them have had meningitis vaccine. So when in fact the trial goes out, 50%, and nobody knows which one they've had. 50% have had a meningitis shot, which is harmless, and 50% will have the trial of the COVID vaccine, which in fact they want to study. So I would hesitate to say that there in fact reinfection going on, but there is the potential. Once again, I refer to Maulana Hazrat, who actually says everyone should follow government guidelines. And that means social distancing. That is so important. And also physical distancing. This contagion is just something we've never seen before like this. And so if people do that, they will not be infected to start with, hopefully not. And certainly those people who have it are not at risk of developing any further problems after they've been cleared.
Thank you. Do you have any good advice for pregnant women? in this current situation?
Pregnant women should not fear, but they should follow exactly the same rules as everybody else. They certainly should not go to be in the proximity of anyone who's unwell. Anyone who becomes unwell in their presence should perhaps self-isolate. But the risk, we actually are not sure if they can be passed on to the developing baby. We are hopeful that it does not occur. So far, it's too early to tell of any untoward events. But generally, pregnant women are in the younger age group who are generally less prone to getting any serious side effects from the disease. It's not unknown, but so far, so good. So I like to reassure all those who are pregnant not to worry unnecessarily about COVID affecting them badly, although, again, we are not sure on the individual person how badly they'll be affected, if at all.
Great, thank you. We have an audience member asking, what scope does plasma treatment have for critical COVID patients? Are there any positive scientific results?
For the first word I missed again, what was the first word you mentioned?
What scope does plasma treatment have?
I'm not sure that we can actually decide on any definite treatment at this time. The best treatment we have is supportive care for those who have extreme symptoms. The best form of care for those who are well enough to stay at home is to guide them on what to do. There is no active treatment, no vaccine, no medicines, no antibiotics, nothing is known to be able to cure this virus. So our scope may change in the future. But once we have a vaccine developed, then hopefully we will be making some inroads into reducing and eradicating the disease.
And one last question. How does the ease of restrictions implemented by the government impact the current situation? What precautions do we need to take?
I would follow the government guidelines, absolutely, but I would also say it will be wise at this time not to rush out and do things which you say with a sigh of relief, at last we're free, we can do that. I'd be very, very cautious about going out and living the life as you did before until we are quite certain that the danger is past. So even though there's an easing up, that will probably only be for essential people, essential workers, and we're not all essential. So we need to remember, as Ram has said, this is a very contagious virus. And in fact, practicing physical distancing is absolutely manifestly important, essential are his words there. And so I would not want anyone to take a risk, which in fact is certainly inadvisable at this time, even though there may be some easing up in certain areas there. It's very, very important to appreciate the physical distancing aspect until we see light at the end of the tunnel.
Great.
Can I just add that we have received this very fortunate guidance. I've included it in my talk from Maulana Hazrat Imam. We are very lucky indeed to have that message today for all who actually have read it.
Definitely. We will be continuing on with questions for a little while longer. So another question we have from our audience is, are there good tests and bad tests when it comes to COVID-19? Someone they know was tested positive, but then got retested and was declared negative.
The rule about this is if you test positive, you are positive. There are some false positives, but very few. This test is, if it's applied correctly and you're positive, then you must accept that result. If it's applied incorrectly, and there are two ways of taking it, either a pinprick or an injection drawing off blood. If in fact it's not done properly, there may not be enough of the sample to actually prove you are positive. Or you may be developing the disease more fully, but not necessarily have been able to produce enough of the particular component which they need to prove you are positive. Once you're negative, the rule is that you need to have 2 tests, 24 hours apart, 2 separate tests, both of which must be negative. If the first test is negative, you can't go home from the hospital yet. You have to have that second test. And when that second test is negative, you are then cleared. But you just don't go home to a normal life. You may need to recover. You may need to rest. You may need to exercise. You may need to recover from your fatigue and the trauma of having been so ill in hospital. If you are not affected so seriously, the same rule applies. 2 tests, negative, 24 hours apart, and you're pretty certain. It's a very specific test. You're pretty certain that you're okay. The antibody test people talk about, but that's not as good as the COVID blood test, not at this time.
Thank you. Is it safe to go to the barber for a haircut?
I think you can see a kind of hirsute man in front of you. I would advise not going to a barber shop, not because of the barber, but because of the people who actually come in. You don't know who they are. You don't know where they actually have hailed from or what conditions they've been living under. You're not going to accuse them of anything. You want to be sure, of course, all the instruments and implements that are in the shop are sterile and clean as well. If it's absolutely essential that you have to go, what is absolutely essential? What can you not do at home or put up with for a bit longer, whether it's long hair or a hairy beard or whatever? My advice again, stay home, stay safe. Don't take unnecessary risks. This is not a time for bravado.
Thank you. Our next question is, what is the duration of the virus? How long can someone be infected by it?
Well, this is a difficult one to answer because the infectivity, usually once you're exposed to it, you are going to develop it within 2 or possibly even as short as 1 day, up to 14 days. The best thing, and this is what we have for quarantine and self-isolation, is if you have any signs of any illness, is to self-isolate. But if you have any symptoms at all, and you actually remain at home, you must self-quarantine yourself. If you are diagnosed positive and admitted to hospital, they will not let you go home until they're perfectly satisfied that you are clear of this disease. I'm not sure I answered your question fully, but that's actually the guidance.
Thank you. We have another participant asking, there are some immunity boosters available for children like Septlin. Are they advisable?
No, no additional vaccination or immunization has been shown to be helpful against this virus. If in fact they're helpful at all, it's for the very disease they're given for. So for instance, pneumonia and various other disorders are more prevalent in certain people, and children in particular, things like measles. We talked about polio earlier. There's mumps. If they have those injections, and they certainly should stick to their schedule and have those vaccinations as per routine, they will help only those viruses. They will have no impact on COVID-19.
Thank you. Can the air conditioning system in someone's building transfer the virus if anyone is infected?
This is unknown. Most places now have HEPA filters. Airplanes have HEPA filters in normal life, so that someone in the back is not going to give someone in row 64 a bad cold. The air is cleaned very, very rigorously, and the sanitation and hygiene on planes is excellent in most of the up-to-date airlines. So it's not a question of air conditioning spreading germs everywhere that they ventilate. The COVID-19 isn't just in the air. It has to be spread. It's spread by contact, the contagion. It's also spread by droplets of a human, if you like, saliva being released from the mouth. during contact. That's why we say you must stay 2 meters away, because all of the saliva droplets fall to the floor. The bigger they are, the heavier and closer they fall. The very fine ones, in fact, can probably not travel more than 3 or 4 feet, if that. The warning is, keep that physical distance, and you should be okay. And now we're all mandated to wear masks, so that actually should be a reminder to stay away. And remember also, when you have a mask, try not to touch your face in any way, your eye, your nose, or your mouth. Those are the ways which the virus can enter your body. So a mask at least helps protect you from touching at least 2 of those important areas.
Perfect, thank you. And with that, we will now be concluding the Q&A segment of our program. Thank you very much, Dr. Verjee, again, for all your educational information on COVID.
Thank you very much. Ramadan Kareem to all, and I wish you that you stay well and stay safe. And please don't forget to wash your hands.
Thank you. I'm sure everyone listening took something away from that presentation and will follow what the doctor shared with us. Now, due to some prior technical difficulties,